We'll go ahead and get started. Billy was sitting on the couch watching TV when he started to get a stomach ache. He decided to go to the emergency room because his stomach ache worsened. We'll follow Billy as he goes from the ED to an inpatient admission. During his stay, he will go to surgery to have his appendix removed, spend some time recovering, then discharged to home. And Dawn is going to kick us off.
I'm an ED physician. I'm reviewing Billy in the ED and decide that Billy needs an abdominal ultrasound to assess his stomach pain. I will place the imaging order now. Sign in as an EDRN. And find Billy on my track board. I am Billy's nurse. I can see the imaging order has been placed on my track board. I've assessed Billy and he is ready to be transported to radiology. I will use the EDRN updates button with the patient RAD status button to mark him as ready, which will notify the RAD tech that Billy has been prepared for his exam.
I am an ultrasound technologist. I will access my tech work list to see my patients for the day. I'll check my schedule orders report to see if there are any inpatient or ED exams that need to be scheduled. There it is. I see that Billy's on my schedule orders report and have been marked as ready for his exam. Sorry, I don't think the button actually got picked because it would show up right here. On the ED side, so I'll now add it to my tech work list and request for transport since I'm ready for Billy's exam.
All right, so I'm not seeing the transport request. There we go. All right, I am the transport technician, and I work within the radiology sector using my Rover device to manage my transport requests on the go. I can see the request has come through to bring Billy from the ED to the ultrasound imaging department. So I'll acknowledge my request and I'll head over to the ED to pick up Billy. So once we have arrived in radiology, I'll mark the transport as complete. Back to Nancy.
I can see that Billy has arrived. I'll check him in for my tech work list and begin the exam. Once my images are complete, I will end the exam and complete all the required documentation. And now that Billy's exam is done, I need to get him back to the ED, so I'll request a transport so he can be sent back there and back to Grand Central.
Okay. I'm the transporter working in the radiology sector, and I can see my Rover device that a new request has come through to bring Billy back to the ED now that his exam is complete. So I'll accept the request, head to the radiology department to pick Billy up, and once he is back in his ED bed, I'll mark that transport as complete.
I am the EDRN and I can see on my track board that Billy has returned to his ED bed now that the transport has been marked complete. No intervention is needed on my end. As soon as the transport technician completes their request, Billy's location will automatically update. Then I need to sign in as an EDMD. Reviewing all the documentation, we decide Billy will need to be admitted as an inpatient and require surgery for his appendix. I will call the hospitalist to discuss admitting Billy. I will document the patient's disposition to admit with a clinical impression of appendicitis and place the ED to floor bed request order. This will begin the process to move the patient to an inpatient unit. Bed planners will be able to act on the bed request before an admission order is placed. I'll pass it to Grand Central.
I am now logged in as the bed planner. I can see on my unassigned tab that a new request was not generated for Billy. There he is. Was generated for Billy and grouped under the emergency department heading. If I need to assign Billy to a bed, I can browse through the bed board and determine a unit, room, and bed in which to place Billy, and I can see the request information on the right. So when I locate a room for Billy, I will drag and drop him into the selected bed to complete the assignment. Once I assign him, he moves from my work list of patients needing beds to my assigned list. I'll pass to Jen for orders.
Okay, I am logged in as the inpatient physician. I'm currently down in the ED consulting on Billy, who might need to be admitted based on the call that I had with the ED physician. I have a slightly different workspace than the physicians in the ED, so instead of the ED track board, I'm going to use my patient list to find Billy. To do that, I'm going to use the emergency department system list. So I'm going to go to WB, 2 units, and go to WB emergency to find Billy. I'll open Billy's chart. In the patient summary activity, I can see a summary of, or a snapshot of Billy's history, medications, and problem list. After reviewing the chart, I have confirmed the prognosis that I am going to admit Billy. To do that, I'm going to use the admission navigator. That will guide me through all the steps I need to do to complete an admission. And I will start by doing the admission medrec. On the right side, under hospital orders, I can see anything that was placed in the ED and continue, discontinue, or modify those orders. And on the left side, under the home medication section, I can see Billy was taking lisinopril before showing up in the ED. From there, I can choose to order the home med for the admission. So I'm going to go ahead and select the plus sign to continue his lisinopril while he's inpatient. At this point, I'll place additional orders to be carried out upon his admission. So I will go ahead and place my favorited general admission order sets, which has the admit order and some pre-selected orders that I have already selected as my favorite. So I'll go ahead and that looks good. I do have required fields in the admit to inpatient that I will also need to complete. So general, it's going to be an acute appendicitis. We're going to have Dr. Isakovic be admitting. And then the care team is going to be the WB hospitalist. Go ahead and accept that order. And then I will sign and hold those orders. And then I will pass it back to Dawn.
I am now logging in as the ED nurse, getting Billy ready to go to his inpatient unit. I can see from my admits view that Billy has a bed assigned. I can also see that he has an admit order and signed and held orders. I'm going to call the inpatient nurse to give her a handoff on this patient. I'll mark this patient ready to move, show that he's good to go. If bed planning hasn't picked a bed yet, this would be an indicator for them to prioritize this patient. Once we're done with our handoff, we'll get Billy moved up to the unit. When I mark Billy ready to move, I automatically create a transport request for Billy because he is assigned to a bed that is clean and ready. Because there was an available transporter, I can see that it is assigned right away. If transport is not available, the ED staff will transport the patient. When Billy leaves the ED, we'll move him to off the floor bed in the ED manager. This frees up his bed.
I am transporter working on my mobile device. I just got notified to pick up Billy from the ED. I can see his clinical information and access the ticket to ride on my device. I'll acknowledge the request and head to Billy in the ED. Once we are on the way, I'll mark that in progress. And when we get to the next unit, Med-Surg, I'll mark complete. Passing to Sarah for ClinDoc.
All right. So I'm now logged in as the inpatient nurse on West Burlington Med-Surg, who will care for Billy. I see Billy arriving in my unit from the transporter. I can find this patient on my unit manager. And because the transport was automatically completed, the patient transfers to their bed. So I'm going to drag and drop Billy to his bed in room 243 and then complete the transfer. This will also remove the patient from the ED track board and add them to the West Burlington Med-Surg patient list. Now that the patient has arrived in Med-Surg, I can assign myself to the patient's treatment team. Billy on my patient list, I will right-click and assign myself, and then double-click to open his chart. I can now review the admission orders that need released using the admission navigator. I will click the release or click in the release orders section, open up all the orders. I can select all the admission orders and then select release. From this point on, Billy is ready to receive inpatient care. Passing to Jen.
Okay, it's time to get Billy prepped for surgery. As the inpatient physician, I want to place a physician-to-physician consult order in an inpatient setting. I'll start by finding Billy in my patient list. I am on my Med-Surg list. You can double-click to open Billy's chart. I decide to place an order for a consult to surgery, so I'm going to go to my orders navigator and place a inpatient consult to general surgery. I will go ahead and select the WB surgery team and the reason for consult for an appendectomy. And go ahead and sign that once I have fulfilled the required details. I will then go ahead and sign that order. And then I will select the secure chat icon to send a message to the surgeon to communicate that the consult was requested. I'm requesting a surgical consult for a male with suspected acute appendicitis. And I'll go ahead and send that secure message to the surgeon. And I will pass it over to Amanda.
So I'm logged in as our general surgeon here. I'm going to navigate to my patient list. Billy here on my list. I'm going to go ahead and open him up. After reviewing the chart, I agree. Billy needs to have surgery. So I'm going to place a case request for this. Normally I would do this in a order set, but today I'm going to just do the case request. So we are going to put that we are going to do it at the West Burlington Main OR, the procedure that we're going to do, and then we are going to mark it for today because we are adding this on. So we're also going to mark it as an add-on case. I'm going to accept this here. I'm going to go ahead and assign the order. This is telling me that I need to call the scheduling desk because we're adding it on. So just to make sure that they are aware that we need to add this case on for today. And I will log out. So that case request has now gone to our scheduler. So I'm going to log in as one of them. I'm going to open the case from the Case Depot, which is down here. I find Billy here. I'm going to open it and I'm going to take a look just to make sure all of the required documentation. Patient class type is going to be inpatient because he is currently in the hospital. Everything else looks good here. So I'm going to go ahead and hit schedule. And then I'm going to drag and drop the patient onto the schedule for today. Once Billy is scheduled, we can bring him to start prepping him for his surgery.